Very good morning, everybody. Today, I will discuss a very interesting and important topic of the clinical refraction. In your examination, you may get a question like that: how you find out a case of astigmatism by the or with the help of a retinoscope, or if at all you find out an astigmatism case, so how do you assess or how do you select the final and correct axis of that astigmatism or of that cylindrical error with the help of a retinoscope. So today our topic is the retinoscopy in astigmatism. Okay, so in the next slide, so this is the four characteristics of the retinoscopic reflex which will be found in case of astigmatism. So these are the break, these are the intensity, number 3 is the thickness, and number 4 is the skew movement. Okay, so in short, these initial words are simultaneously called the beats in the reflex. So this beats in the reflex is the characteristics of an astigmatic case when you're doing the or performing a retinoscopy on a patient. Okay, so let's understand what is this break. So look at this picture. It is a very familiar picture who are known who are doing retinoscopy. So this is the retinoscopic reflex, you know, that this and this is the retinoscopic reflex, and this is the retinal reflex, or means the reflex which are on the eye, isn't it? But when you are doing retinoscopy, in normal case, what happen? This retinal reflex and this retinoscopic reflex both are in a parallel, but here they are not parallel. The retinoscopic reflex are aligned in this way, and retinal reflex aligned in this way vertically, and this reflex is tilted slightly. So there is a break, there is a break in that position, in this position. So this is called as a break which is found in an astigmatic case. So when you are performing retinoscopy, okay, and you are find that there is a break in the retinoscopic reflex, you can sure that the person have an astigmatism. Okay, so you can read out from the slide that a break is observed when the streak is not oriented parallel to one of the principal meridians. The reflex streak in the pupil is not aligned with the streak projected on the iris and surface of the eye, and the line appears broken. Okay, so this is the break, and the break disappears when this projected streak is rotated to the correct axis. What to say? What is meant to say is that this retinoscopic reflex, when rotate in this direction, then these reflex and these reflex are in a single line, are in parallel. Okay, so this is the break. Next comes to the intensity. So there is no picture actually I have given in this slide, but try to understand that the intensity means that when you are in a wrong axis, okay, and when you are in a correct axis, so the intensity of both the scenarios or both the situation is different. So when you are in a wrong axis, the intensity is lower, and when you are on the correct axis, the intensity is brighter. Okay, so that is written in this slide that the intensity of the line is brighter when the streak is on the correct axis. Okay, so move to next slide. It is a thickness. So it is a third characteristics of an astigmatic cases found in the retinoscopy. Okay, so similarly, now you know that this is a break, means this have an this patient have an astigmatism. So when the you projected the retinoscopic light on the wrong axis, you find that this retinal reflex is a bit thick, the thickness is more, but when you align the retinoscopic reflex with the retinal reflex on the correct axis or on the correct meridian, it is more thin now. So thickness is decreased when you are on the correct axis. And in our previous slide we have studied that the intensity is increased when we are on the correct meridian. Okay. And next comes to the skew movement. So skew is a type of movement, okay, and you can say that it is an oblique motion of the streak reflex. So what this oblique motion means, so what it mean to say is that suppose this is the retinoscopic reflex, okay, and this is the retinal reflex. So normally what should happen that if you move the retinoscopy in this direction, so all this retinoscopic reflex also should move in this direction, not in another direction. But in astigmatic case what happen, if you move, suppose you move the retinoscopy in this direction, and this retinal reflex means the reflex on the eye moves in somewhat other direction, means oblique to this move, oblique to the movement of that retinoscopic reflex, not parallel. Okay, so that is the skew movement. So they are this retinoscopic reflex are moving downward, but these are moving horizontally, there is no downward movement here. So this is the skew movement. Okay, and it may be used to refine the axis in the small cylinders. If the retinoscope streak is off axis, it moves in a slightly different direction from that of the pupillary reflex. Okay, and the reflex and streak move in the same direction when the streak is aligned with one of the principal meridians. So now if, when by rotating or aligning this retinoscopic reflex, when this retinoscopic reflex and this retinal reflex both are moving in the same direction, then only we can assure that now we find out the correct axis of this astigmatic error or of this astigmatic case. So it is a way of find out the correct axis of astigmatism. But how do you confirm that this axis what we have find out is correct axis, not the wrong one? Okay, so for the confirmation we need to do the straddling test. Okay, so now let us explain what is this straddling. Okay, so let's suppose after doing all the previous preliminary assessment and tests like the break, thickness, intensity, and then after assessing the skew movement, we have finally found that in this case the patient have a cylinder axis at the 80-degree. Now we need to confirm whether this 80-degree is the correct axis of that cylinder or of that astigmatism or not. So for that, what we need to do, we just rotate our streak to 45-degree at the amount of 45-degree clockwise and 45-degree anti-clockwise from the correct meridian. Okay, so here the correct meridian is the 80-degree, so 45-degree in the clockwise direction it is 35, and 45-degree in the anti-clockwise direction it is 125. So after rotating 45-degree in two different direction, we need to assess the thickness of the retinal reflex. Okay, in if in both the position after rotating 45-degree clockwise and 45-degree anti-clockwise, one after another, if the retinal reflex thickness is equal in both the time, then we can assure that the axis of 80-degree it is a correct axis. Okay, but if, as seen in the picture, that the thickness of the retinal reflex is not equal when we rotate clockwise 45-degree and anti-clockwise 45-degree, means that this axis 80-degree is not correct. So we need to further refine or further modified our axis. Okay, but how do you modify or refine this axis? So for that a rule is there, that is when we are working with the plus cylinder lens, our target is to rotate the lens at the amount of 10 degree on the position when the retinal reflex is thin. Means, for example, in this case, we have seen that when we rotate 45 degree anti-clockwise, means the 125 degree, at the 125 degree, the retinal reflex is thin. Okay, so we need to rotate our cylinder axis from 80 degree at a amount of 10 degree, means to 90 degree, and in this position. Okay, in anti-clockwise rotation we need to do. If the case is like that, the thickness is reduced here, means here it is the thin, and if it is the thick, then we need to rotate in the clockwise direction at a amount of 10 degree. Okay, so this is the straddling, and by straddling method we can confirm our retinoscopic axis. We can confirm our astigmatism axis with the help of a retinoscope. So this is all about the retinoscopy in astigmatism. How do you find out and how do you make a correct assessment of the astigmatism axis? So thank you everybody. If you have any queries, please write us at comment. Okay, thank you.